Hello class, my name is Roger Tunks, and this is a project for Nursing 561, the narrated tech presentation. I'm currently in the Psych Mental Health Nurse Practitioner program, so my technology will revolve around that program. The technology that I've chosen is called MedCalc. And MedCalc is an app that is downloadable for Apple or Android. This app is for providers, for nurses, as well as patients even. There's a comprehensive database full of formulas and calculations, each one for its specific specialty. The ones that I'll choose will be for psychiatry or psych mental health nurse practitioning. These formulas help for diagnostic, calculation decisions, clinical decision making, and helping predict the outcomes of patients. So getting started with this app, first you will be able to find this app in either your Apple or Android app store. I have an Apple, so in the Apple store I was able to find mine, MD Medical Calculator. The icon is there on the top left. I downloaded it, and the first step is to sign in. Now when you're setting up your account, it's very important that you go to specialty, and when you're at specialty, to click in the specialty you want, either for psych nurse practitioning, acute care, critical care, emergency medicine, whatever that specialty is, will help them narrow down the formulas that you'll see later. Once you get to the home page, you'll have the top will be favorite, recent, my specialties, and all. And this is why it's important to have that specialties put in. I put in psychiatry, and it narrowed down to all of the formulas and tests for psychiatry. It narrows it down quite extensively from the long list that's before. You can find a formula by searching at the top or by scrolling through. To search at the top, if you put in ADHD, one of the scales that you'll get will be Adult Self-Report Scale. I selected this formula, and the app will run you through a new formula that you never used before. When you first click on the formula, it will go to when to use, and this will help you decide if your current patient population is the right to use this patient for. For this, it needs to be an adult. You need to be able to continue to monitor, and this is to use to be able to monitor symptoms and for being able to see change. The next box is for pearls and pitfalls, and this will tell you if that current test or formula that you're on, if it won't work for a certain demographic, or if patients can lie to you about certain things, and it will skew your results. The third one is why to use, and this talks about the prevalence of ADHD in adults and underdiagnosing. So to be able to use this scale to be able to diagnose those who have ADHD. So once you have decided that this is a formula that's correct for your patient, for your patient population, you're going to go through and have questions. You'll either answer them by clicking on boxes or by writing in numbers. Almost everything in psychiatry is going to be questions that you will fill out with clicking on boxes, very little numeric formulas. Once you get through all of the questions, at the very end, at the very bottom, it will have a results. It will tell you your likelihood or your percentage of having the certain diagnosis. So once you have gone through the steps with your patient and figured out the likelihood of your patient having this diagnosis, you can go to the next step. Now the next step is gives you advice, management, and critical actions. This gives you advice of what to take next step for the patient, what continuing tests that you might want to run, and what other diagnostic criteria might be particular for this patient. There's also critical actions, things that you might need to do right now. In psychiatry, a lot of those will be directed in towards emergent psychiatry, and some of the ones with emergency medicine or with critical care might need to be continued adding different tests to um, or implementations that you need to do at this time. The next step is evidence, and this is what makes this app so great for providers, is it tells you the facts and figures and the evidence of why is this diagnostic study relevant and how successful is it. It's specificity and sensitivity ratios, and then it also gives you the literature so you can read about why this how the study came to be, and it also has validating studies to show to prove the validity of these different tests. I pulled up some examples for psych mental health nurse practitioner. I want to go into a private practice outpatient, and my top 3 diagnoses will be ADHD, anxiety, and depression. And these are 3 different studies. Now, this software can be used for many different specialties, anything from nephrology, neurology, emergency medicine, critical care, and it will, when you go to the all section, it will tell you the many different types of tests, and you can click on all of those. Now, the pros and cons of this app. The pros is obviously the evidence that is so readily accessible that you can look up the studies that prove why this diagnostic criteria is relevant, to see why this test has been proven over a certain patient population. The second pro is it's readily accessible to others, including patients. There's providers that have their patients use this app periodically to be able to monitor where they're at with either their depression, their anxiety, their ADHD, to see if medications or treatment is currently working. The other pro is being able to put all these different formulas in one location for all these different specialties, instead of having to save on your computer multiple different tests or to have to look these up every time. It's all in one app that you can find. The cons for this is if you were doing this with a patient, you would have to have your phone in front of you. If you didn't have these memorized or have written down, you'd have to have your phone in front of you while talking to a patient, which is obviously a distraction. And the other con is you can't add any formulas of your own or tests that you find that have been helpful in your practice. You have to stick to all the formulas that they have for themselves. So the relevance of this as a psych mental health nurse practitioner is, one, for education of myself. As I go through these, I can learn about new and different studies and diagnostic treatment and tests that I can go through with my patients. Because of the ability to look up the evidence, I can know that I'm doing best practice and doing studies that have been proven by other providers and other studies. The second is to be able to do patient involvement. I think it's great that a patient can download the app and monitor their own symptoms on a prescribed basis to be able to see how well medications or treatment is doing, that they can have a quick resource to be able to go through and to be able to either see progress or know when they need to seek additional help. This is definitely something that I will include in my practice, being able to look up all of these different tests and diagnostic tools in one handheld device will be very effective in an outpatient setting. To summarize this, for someone to be able to get this app, MD Calc, you're going to download it for free from the App Store, set it up including with your specialty. To find relevant formulas, either by searching or scrolling through, to be able to research the evidence to make sure that this is a diagnostic test that meets the qualifications for your practice and your own personal standards, and then to be able to use this as a provider for yourself and also with patients to be able to make clinical decisions and to be able to see patients have progress or know when they need to get additional help.